Deep vein thrombosis (DVT) occurs when a blood clot thrombus forms in one or more of the deep veins in your body, usually in your legs. Deep vein thrombosis can cause leg pain or swelling but may occur without any symptoms. Deep vein thrombosis can develop if you have certain medical conditions that affect how your blood clots. Deep vein thrombosis can also happen if you don't move for a long time, such as after surgery, following an accident, or when you are confined to a hospital or nursing home bed. Deep vein thrombosis is a serious condition because blood clots in your veins can break loose, travel through your bloodstream and lodge in your lungs, blocking blood flow. Pulmonary embolism. Symptoms. Deep vein thrombosis signs and symptoms can include swelling in the affected leg. Rarely, there may be swelling in both legs. Pain in your leg. The pain often starts in your calf and can feel like cramping or a soreness. Deep vein thrombosis may sometimes occur without any noticeable symptoms. Causes. Deep vein thrombosis occurs when a blood clot forms in the veins that are deep in your body, often in your legs. Blood clots can be caused by anything that prevents your blood from circulating normally or clotting properly. Risk factors. Many factors can increase your risk of developing deep vein thrombosis (DVT), and the more you have, the greater your risk. Risk factors for DVT include inheriting a blood clotting disorder. Some people inherit a disorder that makes their blood clot more easily. This inherited condition may not cause problems unless combined with one or more other risk factors. Prolonged bed rest, such as during a long hospital stay, or paralysis. When your legs remain still for long periods, your calf muscles don't contract to help blood circulate, which can increase the risk of blood clots. Injury or surgery. Injury to your veins or surgery can increase the risk of blood clots. Pregnancy. Pregnancy increases the pressure in the veins in your pelvis and legs. Women with an inherited clotting disorder are especially at risk. The risk of blood clots from pregnancy can continue for up to 6 weeks after you have your baby. Birth control pills or hormone replacement therapy. Birth control pills, oral contraceptives, and hormone replacement therapy both can increase your blood's ability to clot. Being overweight or obese. Being overweight increases the pressure in the veins in your pelvis and legs. Smoking. Smoking affects blood clotting and circulation, which can increase your risk of DVT. Cancer. Some forms of cancer increase the amount of substances in your blood that cause your blood to clot. Some forms of cancer treatment also increase the risk of blood clots. Heart failure. People with heart failure have a greater risk of DVT and pulmonary embolism. Inflammatory bowel disease. Bowel diseases, such as Crohn's disease or ulcerative colitis, increase the risk of DVT. A personal or family history of deep vein thrombosis or pulmonary embolism. If you or someone in your family has had DVT or pulmonary embolism before, you're more likely to develop DVT. Age. Being over age 60 increases your risk of DVT, though it can occur at any age. Sitting for long periods of time, such as when driving or flying. When your legs remain still for many hours, your calf muscles don't contract, which normally helps blood circulate. Blood clots can form in the calves of your legs if your calf muscles aren't moving for long periods. Complications. A concerning complication associated with deep vein thrombosis is pulmonary embolism. Pulmonary embolism. A pulmonary embolism occurs when a blood vessel in your lung becomes blocked by a blood clot thrombus that travels to your lungs from another part of your body, usually your leg. A pulmonary embolism can be fatal. So, it's important to be on the lookout for signs and symptoms of a pulmonary embolism and seek medical attention if they occur. Signs and symptoms of a pulmonary embolism include unexplained sudden onset of shortness of breath, chest pain or discomfort that worsens when you take a deep breath or when you cough, feeling lightheaded or dizzy or fainting, rapid pulse, coughing up blood. Postphlebitic syndrome. A common complication that can occur after deep vein thrombosis is a condition known as postphlebitic syndrome, also called postthrombotic syndrome. This syndrome is used to describe a collection of signs and symptoms, including swelling of your legs, edema, leg pain, skin discoloration, skin sores. This syndrome is caused by damage to your veins from the blood clot. This damage reduces blood flow in the affected areas. The symptoms of postphlebitic syndrome may not occur until a few years after the DVT. Tests and diagnosis. To diagnose deep vein thrombosis, your doctor will ask you a series of questions about your symptoms. You'll also have a physical exam so that your doctor can check for any areas of swelling, tenderness or discoloration on your skin. Depending on how likely you are to have a blood clot, your doctor may suggest further testing, including ultrasound. A wand-like device transducer placed over the part of your body where there's a clot sends sound waves into the area. As the sound waves travel through your tissue and reflect back, a computer transforms the waves into a moving image on a video screen. A clot may be visible in the image. Sometimes a series of ultrasounds are done over several days to determine whether a blood clot is growing or to be sure a new one hasn't developed. Blood test. Almost all people who develop severe deep vein thrombosis have an elevated blood level of a clot-dissolving substance called D-dimer. Venography. A dye contrast agent is injected into a large vein in your foot or ankle. An X-ray procedure creates an image of the veins in your legs and feet to look for clots. However, less invasive methods of diagnosis, such as ultrasound, can usually confirm the diagnosis. CT or MRI scans. Both computerized tomography (CT) scan and magnetic resonance imaging (MRI) can provide visual images of your veins and may show if you have a clot. Sometimes a clot is found when these scans are performed for other reasons. Treatments and drugs. Deep vein thrombosis treatment options include blood thinners. Medications used to treat deep vein thrombosis include the use of anticoagulants, also sometimes called blood thinners, whenever possible. These are drugs that decrease your blood's ability to clot. While they don't break up existing blood clots, they can prevent clots from getting bigger or reduce your risk of developing additional clots. Usually, you'll first be given a shot or infusion of the blood thinner heparin for a few days. After starting heparin injections, your treatment may be followed by another injectable blood thinner, such as enoxaparin, Lovenox, dalteparin, Fragmine, or fondaparinux, Arextra. Other blood thinners can be given in pill form, such as warfarin, Coumadin, Gentovan, or rivaroxaban, Xarelto. Newer blood thinners also may offer additional options in the near future. You may need to take blood thinners for 3 months or longer. If you're prescribed any of these blood thinners, it's important to take your medication exactly as your doctor instructs. Blood thinning medications can have serious side effects if you take too much or too little. You may need periodic blood tests to check how long it takes your blood to clot. Pregnant women shouldn't take certain blood thinning medications. Clotbusters. If you have a more serious type of deep vein thrombosis or pulmonary embolism, or if other medications aren't working, your doctor may prescribe different medications. One group of medications is known as thrombolytics. These drugs, called tissue plasminogen activators (TPA), are given through an IV line to break up blood clots or may be given through a catheter placed directly into the clot. These drugs can cause serious bleeding and are generally used only in life-threatening situations. For these reasons, thrombolytic medications are only given in an intensive care ward of a hospital. Filters. If you can't take medicines to thin your blood, a filter may be inserted into a large vein, the vena cava, in your abdomen. A vena cava filter prevents clots that break loose from lodging in your lungs. Compression stockings. These help prevent swelling associated with deep vein thrombosis. These stockings are worn on your legs from your feet to about the level of your knees. This pressure helps reduce the chances that your blood will pool and clot. You should wear these stockings during the day for at least 2 to 3 years if possible. Compression stockings can help prevent postphlebitic syndrome.